In the realm of health, few adversaries are as stealthy and pervasive as cardiovascular disease. This silent intruder often goes unnoticed until it strikes with devastating consequences. Despite advances in medical science, heart disease remains a leading cause of mortality worldwide, overshadowing other threats like cancer. It is not just an affliction of the elderly. Its roots often trace back to early adulthood, quietly progressing over decades. The circulatory system, a marvel of biological engineering, comprises an intricate network of vessels that could encircle the globe twice if laid end to end. These vessels are more than mere conduits for blood. They are dynamic structures capable of expansion, contraction, and self-repair. Yet, this sophisticated system is vulnerable to a condition known as atherosclerosis, a gradual accumulation of harmful substances within arterial walls. Atherosclerosis begins subtly, akin to a slow leak in a dam that eventually leads to catastrophic failure. Picture a bustling street lined with houses, where the road represents blood vessels and the houses symbolize arterial walls. The protective barrier between the bloodstream and the arterial wall, known as the endothelium, acts like a vigilant gatekeeper, regulating the passage of nutrients and waste. However, when certain particles breach this barrier and become lodged, trouble ensues. Among these particles, low-density lipoproteins, LDL, are particularly notorious. When oxidized, they transform from harmless visitors into destructive agents, inciting inflammation and attracting immune cells. These immune cells, attempting to engulf the invaders, can themselves become overwhelmed, forming foam cells that contribute to fatty streaks, the precursors to arterial plaques. Over time, these plaques grow, potentially obstructing blood flow, or rupturing to form clots, culminating in events like heart attacks or strokes. The complexity of cardiovascular risk extends beyond simple cholesterol levels. A deeper understanding reveals the importance of apolipoprotein B, apoB, a marker indicating the number of harmful particles circulating in the blood. Elevated apoB levels signal increased risk, regardless of conventional cholesterol readings. Similarly, lipoprotein A, or Lpa, presents another hidden danger, often genetically determined and linked to premature cardiovascular events. Prevention hinges on recognizing and addressing these risks early. Lifestyle modifications play a crucial role, including dietary adjustments to manage insulin levels and reduce triglycerides. Emphasizing monounsaturated fats found in olive oil, macadamia nuts, and avocados can foster a healthier lipid profile. For many, however, lifestyle changes alone may be insufficient, necessitating pharmacological interventions. Modern medicine offers a range of tools to combat elevated apoB levels. Statins, the most prescribed class of lipid-lowering drugs, work by boosting the liver's ability to clear LDL from the bloodstream. Other medications, such as PCSK9 inhibitors, provide additional firepower, particularly for individuals with high Lpa levels. Combining these therapies can yield powerful results, significantly reducing cardiovascular risk. Yet, perhaps the greatest oversight in current medical practice is the temporal perspective on prevention. Cardiovascular disease unfolds over decades, yet traditional risk assessments focus on shorter time frames, often missing opportunities for early intervention. By extending the horizon to 30 years or more, healthcare providers can identify and mitigate risks long before symptoms manifest. This paradigm shift from short-term management to lifelong prevention underscores the need for vigilance across all stages of life. Just as one would not wait to extinguish a fire until it engulfs a building, addressing cardiovascular risk should begin early and persistently. Through a combination of informed lifestyle choices and strategic medical interventions, the trajectory of this insidious disease can be altered, paving the way for healthier futures.